Hello. Hello. I thank you so much for joining me today, whether you're joining me live or on replay. Thank you for joining me. I'm really excited to talk to you today about using continuous glucose monitors in your practice and how to get the right price for your clients. So this topic is really exciting for me. A little bit of history on that. My name is Karen Kennedy, and I'm the owner of Real Food Matters. I'm a certified nutritionist and functional nutritionist in the state of Washington. And, my background with using continuous glucose monitors, I started, years ago. I started watching or listening to Peter Attia's podcast, The Drive, which I love. And of course, he and other people like biohackers were using continuous glucose monitors to optimize their health and prevent chronic disease. Someone in my field, someone in your field, we're used to seeing people using continuous glucose monitors to manage diabetes, to dose insulin. But this sounded so exciting to me, and when I first looked into it, I didn't see an avenue, a way in, financially or otherwise. There just seemed like so many barriers to using them for myself and using them for my clients. And price was a big one. And so after a tiny bit of investigation, years ago, I just wrote that off and thought, oh, that's just not for me. And then more recently, I heard about some other companies going direct to consumer, like Nutrisense and Levels, really cool companies. And when I looked into them, I thought, well, that sounds interesting, but the price point was a little too high for my clients. And also, there wasn't a way for me, a nutritionist, a dietary professional, to easily access the data and, and really work with my clients and help them troubleshoot. And it wasn't, what happened for me was when I was at the gym last year and I saw, at the gym they always have ESPN on. I saw them marketing direct to consumer. I saw that telltale, the little white dot on the back of someone's arm. And I immediately stopped my workout. The workout was over and I thought, what is going on here? Whipped out my phone, sat down on the weight bench, and immediately looked up the website, and I realized, oh my gosh, I can afford this and so can my patients. I have to figure this out. So I want to get down and dirty into the money and how much this costs with you, because since then I spent months working it out for myself, finding the friction points and how to make this happen, and keeping notes so that I could streamline this process for myself and then my patients. And it's just been great. I've used this one-on-one with my clients, and I've run groups with patients, and that has been really rewarding and really transformational. And now, of course, the elephant in the room, and templates for clinicians to learn how to do this, so you don't have to actually spend months hacking the system and figuring it out for yourself. And I've also made a packet of gorgeous Canva, brandable Canva templates, so it's just an open and go package for you to just say, okay, here's my package, I'm going to do this in my practice now. Easy. I'll tell you how to do it at the end, because right now I'd really like to show you how to get this going, and let's just talk money. Let's talk money, because money is a real barrier. Initially I thought that this was going to be costing $200-300 a month, even if I could get it at all. And the first thing I realized, the first thing you need to know about using a continuous glucose monitor in your practice really is that there's a few different types of continuous glucose monitors. I'll tell you about today is one is the Dexcom, and the Dexcom is fantastic. It's used a lot with type 1 diabetes in association with dosing insulin, and that is a very expensive. That's in the hundreds of dollars per month. Most of us working in prevention, even helping people reverse type 2 diabetes, reverse prediabetes, and then preventing chronic disease, educating people about how to regulate their blood sugar. That's not what we need. The other technology, the other company who has a continuous glucose monitor out there is Abbott, and it's their Freestyle Libre products. And these products we can get for under $80 a month. $80 per month for this technology. Right? It's so low that I don't think you can afford not to use this, even for a month, because even when my clients use this for 2 to 4, and decide to re-up. Each one of these costs about $37, $38 if you know how to do it. And, that is both diagnostic. It's the equivalent of you can do an oral glucose tolerance test with every food your client likes to eat. So you get a diagnosis. You can show them how reactive their blood sugar is. You can show them how insulin resistant they are. You can show them just how high they spike and how low they crash after they eat certain foods, and how to use exercise and other things to mitigate those blood sugar yo-yos, right? So I just think it's so valuable for that kind of diagnostic that we can use it for. Also, the education and the accountability. It's fantastic. But those bits are for another live. I want to talk to you about the price and how to get this price. So the first thing to know is the hardware that I'm going to talk about is the Freestyle Libre products, and specifically the Libre 2 and the Libre 14-day system. Both of those are available currently in the United States. And here's the big thing with price. And I'm not saying anything bad about the companies of Nutrisense and Levels, because they're just cool. They're great direct-to-consumer companies. But for the dietary professional like me and like you, so if you're a dietitian, a health coach, even if you're a chiropractor, a naturopath, an MD, and you're wanting to use these more preventatively, you want to be able to access the data and troubleshoot directly with your client. It's unfair of me to say, oh, why don't you pay a whole bunch of money for somebody else to be giving you that information when they've already paid, they've chosen me and I can work with them. So that's the first big money thing, is it's really worth it to go through this process that I'll talk to you about, to get the prescription from the provider and to get it from the pharmacy. And that's what I'm going to tell you about now. It's so worth it. It makes it so much cheaper. So the next thing I want to talk to you about is terms, because one of the hang-ups in this is people don't know what I'm talking about when I talk about a continuous glucose monitor or sensor. And basically the cost of these continuous glucose monitors for most of us is just the sensor, this white dot that you see. These sensors, like I said, last 14 days, and it reads your interstitial tissues for glucose levels and gives you a reading. Some people also need to purchase a reader that you scan, because this stores 8 hours of data, and at some time you need to kind of scan it to pick up the data. And you've probably seen people using their phones, and it's because most of the phones have NFC capabilities and can be then you need to purchase a one-time reader, and I'll show you how to do that. So it's a sensor and an optional reader. Those are the two things to purchase. Okay, so that's the terms. The second thing about price, and I'm just going to jump through these because I'd like to just give you the information you came for and then let you get back to work. The other thing about price is understanding the difference between needing insurance and needing a prescription. And I know you know the difference, but they get conflated because most of the things we're going to our provider for and asking for a prescription, They assume we're looking for insurance coverage. All right? We are not necessarily looking for insurance coverage. And if you're a nutritionist or dietitian working in private practice, most of the time you're going to be using this for prevention and education. And these tend to only be covered by insurance if you have diabetes and are using insulin multiple times per day. I have on occasion had somebody who's, if it's been coded for pre-diabetes, obesity, metabolic syndrome, on some insurance plans, they'll starting out, I wouldn't let insurance get in the way, because if your patient's willing to pay $80 to use this for the first month to see how it goes, then don't let the whole insurance thing get in the way. You can address that later, and I'll come back to that. So you're going to ask a provider, would you please write a prescription for this continuous glucose monitor for our patient? And most of your providers will either be unfamiliar with continuous glucose monitors, but more likely they will be, but only in the context of diabetes, especially type 1 diabetes. So it's going to be on you to help educate them. And that's where in the materials that I've made, there's a sample letter to a provider and some information about what you can send and what you can tell the provider, either directly with a release of information or some materials that you can give to your shared patient for them to upload into their doctor's patient portal, right? So they're going to ask for a prescription. And it's helpful for you, again, to ask for the specific prescription and have the right codes for that. And that's all in the materials. But really what you need to do is just say, what I want to do is help our patient get a little more control over their blood sugar. I'm going to use a continuous glucose monitor to do that. Would you please write a prescription for, whichever one you're looking for, the Freestyle Libre 14-day system, and a reader if they need it. So that's the big barrier, is getting the prescription. That is the only barrier, the only real barrier to using a continuous glucose monitor. Very interested in this. Of course, they really appreciate it when their patient is taking an active role in their health. So they'll write this prescription. So in terms of insurance, if you do want to use insurance with your patients, I encourage you to wait on that because, like I said, using a continuous glucose monitor can be a great diagnostic. You can't pick up everything with a fasting blood glucose or A1C. You can pick up insulin resistance. You can pick up reactive hypoglycemia and lots of other things by looking at, 24 hours of continuous glucose data. It's really helpful. And if you work with your patient for 2 to 4 weeks and have the data, you might come to the conclusion of, wow, this person is really in trouble. I think their insulin levels are too high. Their blood sugar is getting out of control. You might take a few screenshots and share this information with their provider, who then quite rightly decides to code for that and try to help your patient get insurance coverage. But that's for down the line. That's for down the line. So now let's say that you've gone to the provider and the provider's written a prescription for this continuous glucose monitor. And now your patient has that prescription and they're sending it to the pharmacy, because that's where you buy these things, the pharmacy or sometimes a durable medical goods supply. But most of the time you're going to be dealing with a pharmacy. Now, what you need to know is that pharmacies charge what they like for these products. Pharmacies charge what they like for these products. They can charge the base rate, which is about $37.50 for each one of these sensors that lasts 14 days, or they could mark it up to $100. And I have seen that vary all over the place in my region. So you have the choice. You can just, send your patients out there and let them fend for themselves. Or, as a dietary professional myself, I know that doctors are busy. It's not their doctor's place to go around and shop for the best price for everything. But I feel like that is in my wheelhouse. You know, if you're a health coach or a dietitian or a nutritionist, you know, you're really trying, it's where the rubber hits the road. You're trying to help them meal plan, and just take some of the friction out of this. And there is nothing like new technology and an inflated price to just put the brakes on a really great is one, recommend that they call ahead to their pharmacy and ask, do you have this CGM in stock, and what is the cash price of it? You can tell them. Or you can go one step further and in your area, call a few of the pharmacies and see what their prices are so that you can already have that in your paperwork. For example, so the paperwork, the thing I sell, I have that information for you, but in my brandable Canva templates that are client facing, in the picking up your prescription from the pharmacy, there's a section in there that says, now ahead of time, call your pharmacy and see who has the best price, and make sure you are getting a price of under $40 per sensor. And if your pharmacy doesn't have it, shop around. Now, learned recently is that you don't have to be a member of Costco to use their pharmacy. And I have seen people go in there and get the absolute lowest price on their continuous glucose monitor sensors. So check that out and recommend that to your patients, please. The other places that tend to have good prices are Kroger's or Fred Meyer Pharmacy, and also Walmart Pharmacy. Those, you know, across the country tend to be very good on their prices. But again, it is worth asking. And it's, as a provider for you, you know, it's just a phone call. Just call the pharmacy and ask them. Don't be surprised if they say, oh, we can't give you that price because you don't have a prescription. We can't give you the cash price because you don't have a prescription. I have been told that twice by pharmacies. Again, because they're so used to that. And you just need to say, actually, I am sending in cash pay patients to purchase these with a prescription. Can you tell me what they'll pay without insurance? And then your pharmacist will say, oh, yes, of course, I can tell. A bit of information is again about the reader. So remember when I said there's two pieces of equipment. There's the sensor that goes on the arm, and that you have to have. And the optional one is a reader, which is like a little glucometer that you will need to buy only if your smartphone doesn't have NFC capability and it can't be used to scan. If you need to get that reader, you have to ask for a prescription for that reader as well. And again, in my materials, that's all, you know, it's all out. But I think in the chat here, very shortly, I'm going to put in some links that's going to help you know this. I'm going to do this right now. So the first link I'm putting in there is a link to my Facebook group. So this Facebook group, it's a free group. I'm putting in a lot of supportive materials so that we can support each other in learning how to use continuous glucose monitors in our practice with clients. It's all free. It's designed there so I can share what I've learned, and other people can come in and share their information too. So if you're interested in doing more of this, please click on that and join that group. I'm going to put another link in here. This is the link. So the first time I got online and was interviewed about this, I did not have these materials to sell you, and people came on and I said, you can figure this out yourself. And people quite rightly said, I don't have time to spend months figuring this system out. Could you just sell me your materials? And I get it. I was a bit of a nerd. I was excited, and I spent a lot of my free time figuring this out and making materials. And what I put on here, the store, is an open and go program. You can just buy the ebook for yourself to learn, and that's enough. You can just buy the brandable Canva templates that are just, you know, you can put your own brand and website and photos on there and send that right off to your clients, and they will love it. It will make you look like the pro that you are, and it is so supportive when you're trying to learn a new technology, and all the information is there with an index table of contents so you know where to look, and links, all the links there with videos and everything. And the last link I'm going to put on there is to Freestyle Libre. It's Abbott's site for the hardware. And this is where I went to learn everything. I figured out everything, well, from this website, from Abbott's website for the hardware. They have a lot of information on there. And in addition, I joined a lot of Facebook groups for people with type 1 and type 2 diabetes using these to see how they were using it. And I followed YouTubers, you know how you do. There's information out there. But I will tell you that the Freestyle Abbott, the website, they have a lot of good information there. I found it hard to navigate. And so what I found helpful and what I did in my handouts is I took all the helpful links from here and I put them in logical places in my handouts so you could link directly to their site for official information. I still find it hard to find information on their site, but it's all there so that you can work this out on your own. Work is, if you're interested in using this technology, do not let price get in your way. Make sure that your clients can get this for $80 a month, definitely under $100 per month. So, you know, under like $40 for a 2-week sensor. Make sure they can get that. You can really grease the wheels by helping them get the prescription from their provider. That requires some collaboration and education on your part, but it might not. I am surprised. The providers who have balked at this tend to be Kaiser Permanente providers. They're always a bit of, it's always like talking to a brick wall with that group. But otherwise, I haven't had any trouble, and people are very receptive to it. So I encourage you to reach out and try. You do not need diagnosis codes. Your patients do not need to have diabetes. In fact, most of my patients that I work with do not. They're people who want to optimize their health. And when they've done this, they feel like they have a coach on their arm, and all of a sudden now they have all the information and all the power to figure out what to eat and what to do to improve their outcomes. I've had people who want to lose weight and can't. You know the type, and they have metabolic syndrome and elevated insulin, and they've got the spare tire, maybe high blood pressure, and they're dieting the wrong way for their bodies. And once they learn how to stabilize their blood sugar, now they know how to eat, and they can stop fighting their body and start working with their body. So it's a wonderful tool for that. I've had clients who come in who are pre-diabetic and on metformin, and we see why once we get them on the continuous glucose monitor. And then we use that data to help them lower their blood sugars. And then once we see that they're really regulating their blood sugar and they have good control, good time in range, then that helps their doctor decide when it's time for them to stop taking metformin. Conversely, I've had clients who come in and their doctors claim, you don't have prediabetes. And then we get them on one of these monitors, and it's so clear that they have prediabetes dangerously. We can take that data, share it with their provider, and of course their provider says, oh my gosh, you have prediabetes. We need to get you on some metformin. And they do. You know, do you see what I mean? And it really, I find this kind of data really fosters great collaboration and great, wraparound care for our patients. So our patients are informed and they're an active member of their healthcare team. By asking for a prescription from the provider, you're looping them in, and that always ends up in better care for our patients. And of course, that's our main goal. But just, inform your patients that this is really affordable. The whole price of this, I recommend people who don't have diabetes to do this for 1 to 3 months. In fact, I think every adult should do this for 1 to 3 months to see where they're at, because we know that Pre-diabetes and diabetes is decades in the making. It's decades in the making. So why not find out now what's making your blood sugar crazy and nip that in the bud. $80 for 1 month or $240 for 3 months. That is so affordable. And like I like to say is you can't afford not to do this. So if you want more information on this, please reach out to me. I have, like I said, go on the website or the Facebook group. I'm on there on a regular basis trying to support other providers and getting support from them, right? Because there's a lot of good diabetes education materials, honestly, are less than using Nutrisense for a month. It'll help you set up your practice so quickly with this. And that's what I want to help you do. Okay? So thank you for joining me. If you have any other questions, let me know. I'd love to do another one of these next month and get you started on this. All right? Thanks for joining me today. Bye.